Welcome back again to our channel. Hope you are always healthy.
Generally, individuals who are paralyzed from the waist down have a mid to lower thoracic spinal cord injury. Sensation and motor control around the waist are typically innervated by the T7 T9 segments of the spinal cord. Because signals from the brain cannot easily get past the level of the SCI, individuals often experience paralysis of functions innervated below their level of injury. The severity of one's spinal cord injury can significantly affect their degree of paralysis. Spinal cord injuries can be complete or incomplete. A complete SCI describes a lesion that transects the entire spinal cord, leaving no spared neural pathways. As a result, complete spinal cord injury patients will have no sensation or motor control below their level of injury, as there is no way for nerve messages to be transmitted past the injury level. In contrast, an incomplete SCI describes partial damage that results in some neural pathways being spared. Less severe SCIs have more spared neural pathways, which is why some individuals can continue to move and feel areas innervated below their level of injury. Now that you understand how spinal cord injury can cause paralysis from the waist down, let's discuss potential complications. Individuals who are paralyzed from the waist down may struggle with loss of muscle mass, also known as muscle atrophy. Following an SCI, individuals may not be able to bear as much, if any, weight on their legs. As a result, the muscles tend to shrink from reduced use. The principle "use it or lose it" describes this perfectly. The more you use your muscles, the stronger they get. Similarly, lack of use can cause them to shrink. The human body is extremely adaptive, and when it senses that a body part is not being used, it'll make changes to conserve energy. Some ways to help combat muscle atrophy include repetitively practicing leg exercises to stimulate neuroadaptive changes in the spinal cord. It is important to note that these exercises do not have to involve any extra weight, as the focus should be on the communication between your nerves and muscles, rather than the amount of resistance you're able to use. Participation in functional electrical stimulation, which involves placing electrodes on the skin over targeted muscle groups to directly stimulate movement, can also help reduce muscle atrophy. This is something that your therapist could further instruct you in to optimally increase motor control and strength.
Okay, for the current video, we've finished that. If you want to know more about their full story, please subscribe and like this channel. If you have suggestions and input, please comment below. Thank you.